Hi, this is Sharma. I am a physical therapy graduate. I have done Bachelor of Physiotherapy from Mahatma Gandhi Medical College, Jaipur, Rajasthan, India. I completed my BPT in 2012. I did my post-graduation diploma in Emergency Medical Services from Symbiosis International University, Pune. Then I did 2-year post-graduation studies in international human rights. I did fellowship in orthopedic physiotherapy from most prestigious orthopedic institution in India, that is Sancheti Hospital, Pune, Maharashtra. And I am very proud to be a student of that institution. So during my fellowship, I learned how to handle a patient who has severe spinal cord injury. Maybe it is traumatic paraplegia, it is traumatic quadriplegia, means patient who has cervical injury, who has lumbar spine injury. So the patient who has spinal cord injury, we used to treat that patients with prolonged rehabilitation and very advanced rehabilitation program. The patient who required orthotics, sometime patient who has amputation required prosthetics as well. So those have severe motor deficit, neurosensory deficit, sensory alteration, and those patients require specially a customized wheelchair. Patient who has at the age of 60 year, maybe patient is fine if he is able to do his activity of daily living, but patient who has traumatic spine injury at the age of 30, he definitely required his needs of the his needs from the life is different. He has to work, he has to drive, he has to use laptop, he has to use workstations. So those patients we require very advanced rehabilitation, very advanced wheelchairs, because most of the time patient is going to spend on wheelchair only. So in that cases, in Sancheti Hospital, we used to give very advanced fine rehabilitation along with very advanced electric kind of wheelchairs, or sometimes manual but with very advanced functions. So wheelchair depends, patient require wheelchair just for transfer from bed to toilet activities, or sometime bed to car. So wheelchair patient require to work, to drive, or sometime just for transfer activities. So according to the age of the patient, according to the need of the patient, depends what kind of wheelchair we are prescribing to the patient. And definitely it depends on age of the patient, because according to the age we need different functions, we expect different things from the life and from the surrounding people. So in that cases we used to give very advanced wheelchairs, customized wheelchair with proper and very comfortable sitting system. So wheelchair assessment, wheelchair training, wheelchair measurement is very important. And most important thing is that we have to give periodic assessment of the patient, because we need to check disease is progressive or not. Because sometimes it happens कि patient's motor function is deficit or it is progressing. So just to find out patient is stable or not stable, we need to do periodic assessment of the patient. So I would say I have very good experience, and I am fortunate that I had very good experience with a patient who has spinal cord injury, and those require customized and very advanced kind of wheelchairs. And I have undergone for the proper training for the wheelchair assessment, criteria of the wheelchair prescription, and most important thing, how we will take proper measurement of the patient to give perfect wheelchair for those patients. So wheelchair assessment, measurement, training, fine rehabilitation. So I have very good experience with that. Thank you.